Hi, my name is Dr. Abdulaziz. I'm the founder and the CEO of Medical Life Care Management College. In this video, I'm gonna to talk some information about intravenous cannulation. The aim of intravenous management is safe, effective delivery of treatment without discomfort or tissue damage and without compromising venous access, especially if long-term therapy is proposed. What are the advantages of intravenous cannulation? Immediate effect, control over the rate of administration. Patient cannot tolerate drugs or fluids orally. Some drugs cannot be absorbed by any other route. Pain and irritation is avoided compared to some substances when given subcutaneous or intramuscular. Indication is fluid and electrolyte replacement, administration of medicines, administration of blood, administration of total parenteral nutrition, hydrodynamic monitoring, and blood sampling.